Okay, this topic is why big universities never cure chronic diseases. And an example is I'm reading a textbook now about neurodegeneration written by the so-called experts, which I, consider the book is an absolute joke. All right. First thing they do is they start recommending the Mediterranean diet. As soon as you hear somebody recommend the Mediterranean diet, you know that they don't know what they're talking about or they're not telling you the truth. Okay. For example, they recommend olive oil. We've talked about that before. It's not good for your arteries. Then they recommend fish. Let me see what I think of fish. Like here you are reading about dementia. Here's a book called Mercury. The author's name is Jane Hightower, and it's a funny book because she's an internal medicine doctor, and she worked in the San Francisco Bay Area, and she would get these young patients in their 40s, some in their 50s, that were becoming progressively demented, and no one knew what was wrong with them. They didn't have a good diagnosis yet. And all she did was test them for mercury. They were trying to be healthy by eating more fish, and they all gave themselves mercury toxicity and were becoming demented. Luckily, she figured it out, but that's my point. Recommending a person eat more fish is recommending that they become demented. You know, all meat is animal muscle. It's, milk is liquid meat. And they're all going to be high in saturated fat, high in protein. They're bad for you. McDougall made that clear a long time ago. And I think that's one of the great things about McDougall. There's nothing ambiguous about it. All meat is bad for you. Same with all dairy is bad for you. Meat is a poison, okay? You need to know that. All vegetable oils, all cooking oils, they're all metabolic poisons. Don't eat them. All processed food is bad for you. Don't eat it. None. No oil, no meat, none, zero. I also recommend no alcohol. And I tell you these things because, health is fragile. And sometimes you get sick and there's no coming back. Person has a stroke. You can't always rehab that. Myocardial infarction. All right. Anyways, one thing I'll notice is that you never hear anything interesting or useful about nutrition coming out of an Ivy League place. Last time I ever heard of an Ivy League place doing anything good with nutrition was the Framingham study, and that was started in 1948. So it's pretty common, even from the big name university centers. So none of the big name universities is good at nutrition. There's not a single one that I'm aware of. Even the Ivy League ones, they're all lightweights when it comes to nutrition. And they could do a big study, but you'll see their conclusions are all, Mickey Mouse hedged and essentially worthless. Let's see, they're going to focus on genetics. We talked about that before. It's where the money is. And I'm like in these books too, it's saying that most Alzheimer's is genetic. That's ridiculous. Almost all of it is dietary. There's nothing genetic about 95+%, probably about 99% of the time. There's a rare genetic variance like with Down syndrome and stuff, but that's rare stuff. The typical researcher will say we're trying to find potential targets for development of new medications. It's always this idea that it has to be a pharmaceutical. You know what? There's a lot of other things a person can do to help their health besides just take a pill. Dietary diseases are never cured by medications. Essentially never, okay? Obesity, you don't cure that with a pill. Diabetes, you cure that by avoiding dietary fat. Hypertension, avoid dietary fat and dietary sodium. Coronary artery disease, eat the Esselstyn diet, okay? That's how you prevent coronary artery disease. You're not going to cure that with a stent or a surgery. Sleep apnea, you're going to have to lose the weight and improve your diet if you want to have a hope of reversing that. You can put a CPAP mask on your face, and that's nice, and that'll be an improvement in your O2 sats at night, but you're never going to cure it with that. Why not try to find optimal diet strategies? How come we never see a study comparing, sweet potatoes or regular potatoes to rice? That would be useful to know. How can we optimize our health? Why not get a bunch of healthy athletes and put them in a bunch of different situations and time them on a stationary bike and see what optimizes performance? Doctors aren't educated in diet. They're not educated in toxicology. That's what causes the vast majority of diseases. Probably about 80% of diseases are caused by bad diet and, exposure to toxins. There's additional diseases caused by bad luck, caused by stress, caused by trauma, of course, but it's a giant gap in modern medical knowledge that the vast majority of persons are not familiar with diet and toxicology. I can tell you, I was speaking to a doctor just recently, a friend of mine, and he said to me, Pete, you're the only person I know, and this guy knows a lot of doctors, you're the only person I know who eats 100% vegan, low-fat, low-sodium diet. And if you study it, that becomes obvious. That's the best diet. Oh, the book, getting back to my neurodegeneration book. Oh, it's using all these pathology classifications that have already been shown to be incorrect. The theories that it goes by, like the beta amyloid theory, it always fails in clinical treatment studies to be of use to the patient. Things that can be modified, like vascular risk factors and toxin exposure, they're not even mentioned or they're downplayed. Okay. One of the things you'll notice is the great nutrition experts, they all come out of nowhere, out of podunk. The last time I heard of a great nutrition expert coming out of university was back in the old days with Kempner coming out of Duke University in Durham, North Carolina. I haven't heard of one since then. They're always some obscure guy somewhere who just figures things out, like Burkitt is a missionary in Africa. Then you hear about Nathan Pritikin with the Pritikin Center. And, that guy was a genius, how much he figured out. McDougall, comes out of nowhere, internal medicine doc. Caldwell Esselstyn, he's from the Cleveland Clinic, but the Cleveland Clinic rejected his work, and they did not want him having an office there. He negotiated one finally, but it wasn't because they wanted him there. T. Colin Campbell, he comes from a big-name place, Cornell, but once he started promoting his original great research, they tried to fire him, and that's pretty typical because it's not profitable. Medicine sort of too much on this productivity model of standard of care rather than optimal care. And here's a hypothetical situation for you. Imagine a big fat 50-year-old man walks into a doctor's office or a nurse practitioner's office, and what are they going to do? It's a safe bet the guy's going to have, he's obese, he's going to have high cholesterol, high triglycerides, high blood pressure, fatty liver, prediabetes or diabetes, coronary artery disease, mild impotence. Almost everybody gets that who eats the standard American diet by 50s. That's just normal aging with that diet. It's like if you had two sets of mice. One fed a healthy mice child, they'd all be healthy. Another fed fat mouse child, they'd just about all be fat and sick. And now that healthcare provider's got to see, let's say, about 30 patients a day, let's say at a big university. And if they don't see that 30 patients a day, they're going to be labeled by the clinic manager lazy, non-productive. And they'll be fired. So they have to follow the standard protocol approach to these patients. They don't get judged by whether or not the patient gets better. No one even keeps track of that. They're simply judged, how many patients did you see today? And as long as they practice the standard of care, they can't be sued. So optimal care is not even considered. No one keeps track of that. No one keeps track of how the patient does. Well, they might keep track of how the patient does, but no one keeps track of the results. Okay, you couldn't do that because if you did, you'd have some little tiny nutrition center promoting the vegan diet would have better results with chronic disease than all the Ivy League schools put together. So they'll never allow comparison of results on chronic disease because the vegan diet would win by so much it's not even funny. But you can see that the standard of care is put the patient on pills for the rest of their life. If the doctor tried to, or the healthcare provider at the big university tried to spend time talking to the patient more than their allotted 15 minutes, they would need a minimum of 2 hours just to get started with teaching the vegan diet and nutrition. They would get labeled as lazy and unproductive, and they would be fired. So if they try to cure the patient, they will get fired. The patient probably wouldn't follow the diet anyways. That's also the case very often. Like I said, all these persons who are starting to know nutrition and still almost none of them do it. It's an obvious choice. The healthcare provider has to match the yield of the pill and send the bill, and they'll make money off that person the rest of their life, and that's what has to happen in the current system. So, what you should learn from this as an individual is you have to take care of yourself. Your doctor can't take care of you. They're under so much pressure to go fast. They don't have enough time to teach you nutrition. You have to teach yourself, and luckily, it's pretty easy to learn. You can just watch videos on the internet, buy a book or two. There's whatever you want to do, you can get it. You can learn it either way, but you got to learn it if you want to keep yourself healthy, keep your arteries open.